Good afternoon, everyone, and let me present in front of you my PhD thesis titled New Insights on Pharmacokinetic and Pharmacodynamic Changes of Drugs in Varied Gravitational Environments. Just a few words about me. I'm a pharmacist and a PhD student here at Semmelweis University and Center for Translational Medicine. This is my research team, and our vision is to enhance drug effectiveness in space, while the mission is to conduct innovative research to optimize drug utilization in space travel. We have 3 ongoing projects right now, and the first one is the effect of different gravity levels on pharmacokinetics and pharmacodynamics of drugs, and this will be a systematic review and meta-analysis. So why space? Well, the use of medicines in space travel is steadily increasing, and the longer journeys that we take, they carry a higher risk of diseases, and this creates a need for larger onboard medication supply. And we also know already that microgravity induces such physiological changes that could impact the pharmacokinetics and pharmacodynamics of drugs. And when these two are impacted, this can result in a reduced effectiveness or worse, intoxication, and this can pose a threat to the lives of the crew. That's why our aim is to comprehensively understand the precise effect of varying gravity levels on pharmacokinetics and pharmacodynamics, and therefore we can suggest necessary interventions accordingly. To achieve our aim, we did a clinical question, which is, do different levels of gravity affect the pharmacokinetics and dynamics of the drugs? And we answered this through a PICO framework where the population is healthy humans receiving pharmaceutical treatment. Interventions include space traveling and microgravity models compared to Earth gravity, and the outcome would be changed pharmacokinetic and dynamic profile. We hypothesize that drugs under effect of microgravity will experience changes on absorption, distribution, metabolism, excretion, and dynamics of the drug, and this can lead to either inefficacy or intoxication. We did a systematic search in 5 different databases with this particular search key, and out of 10,000 articles, we got down to 30 full texts which are eligible and included. Let's briefly introduce the outcomes that we're interested in. There are Cmax, Tmax, half-life, and the AUC. The Cmax is the maximum or the highest concentration of drug in our bloodstream, while the Tmax is the time needed to achieve this maximum concentration. The half-life is the time necessary to reduce or decrease the maximum concentration of the drug halfway in our bloodstream, while the area under the curve or overall drug exposure in simpler terms tells us for how much and for how long does the drug stay in our body. Now let's see some results. We have here Cmax and Tmax for acetaminophen when patients are exposed to microgravity environment for short term, which is 3 days or less. Cmax is measured in micrograms per milliliter, and the normal range is from 8 to 17 micrograms per milliliter, where the Tmax is measured in hours, and the normal range is 0.5 to 2 hours. Cmax and Tmax are very important outcomes because Cmax gives us clues about the safety and effectivity of the drug, while the Tmax tells us for the rate of absorption. Here are 3 different articles or 3 different studies. All of them are NRSI, so non-randomized studies of intervention, and they are bed rest studies or microgravity model studies. Here we have high heterogeneity, which is 64 and 54%, and we attribute this high heterogeneity to pooling together some saliva and blood samples. In terms of results, we have assessed it through the mean difference, and we can see here that the Cmax of acetaminophen when the patients are exposed to microgravity for short-term time is increased for 2.07 micrograms per milliliter, while the Tmax is decreased for 0.68 hours. And even though this change may not sound alarming for our ears, and maybe it's not a big deal for acetaminophen, but for other drugs that may have a narrow therapeutic window, this change can be risky for the patient. On the other hand, we have the same outcome for the same drug, but here for long-term exposure, so which means 30 days or more. And here we have 3 different articles. All of them are, again, NRSIs, but here the Polyakov and Kovacevic article are space flight studies, while the Gandia is a bed rest model. Here we have pretty high heterogeneity, is 91% and 94%. And because this high heterogeneity, and because bed rest studies and spaceflight studies show the contradicting results, we cannot say that these mean differences here reflect the reality of these results. And also here comes up the other issue that maybe bed rest studies or microgravity model studies may not mimic in the best way the spaceflight conditions for pharmacokinetics. These were our finished analyses while we are still waiting for a new forest plot, because we did different pooling strategies based on 4 main points: the type of drug, the type of outcome, the duration of microgravity, and the sample type. And based on this different pooling strategies, we expect, let's say, better forest plots with clear results that reflect the reality and also reduce the heterogeneity. Our study has, of course, strengths and limitations. The strengths include that this is the first meta-analysis on the field, and we included only studies of interventions, and also we included spaceflight studies. While the limitations are high heterogeneity, low sample size, those studies are not randomized, and of course, in space, there's a limited equipment. So as a conclusion, the microgravity environment appears to influence the drug absorption of acetaminophen, because we saw that the maximum concentration is increasing while the time to achieve that concentration is decreasing, and therefore we can say that influences the drug absorption. And also the bed rest models may not mimic the effect of the real microgravity or the spaceflight in the best way for pharmacokinetics. As implication for practice, we can say that we should have higher caution when we dose drugs, especially for drugs with narrow therapeutic windows to astronauts. And as impacts for research, we need more studies, ideally matched with different drugs, and also a future exploration of the effect of the duration of exposure to microgravity. So we finished the duplicate removal, title abstract, and full text selection. We're almost done with data extraction and plan to start the risk of bias in the following days. The second article is with the same background, so it's the same research, but done here we will focus on in animal models, and we're still not quite sure if this will be one large project or it will be separated into projects. While the third one is investigating the effect of spinal cord injury in drug pharmacokinetic changes in humans, and this will be a systematic review and meta-analysis. So again, we have the question, why exactly this research? Well, because the prevalence of spinal cord injury is increasing, and we can see that in 2019, we had around 21,000 new patients with spinal cord injury globally. And we already know that spinal cord injury induces complex pharmacokinetic alterations, and they can impact drug metabolism and drug distribution, but also absorption and excretion. And to understand these changes is very important, because they can pose a risk to the patient's safety, and they can also reduce the effectiveness of our therapy. That's why our aim is to uncover the link between spinal cord injury and pharmacokinetic changes, and therefore we can offer insights for improved clinical practices. To achieve our aim, we asked a clinical question, which is, how does spinal cord injury influence the drug pharmacokinetics? And we plan to answer it through a PACO framework, where the population is humans receiving pharmaceutical treatment exposed to spinal cord injury compared to those that don't have spinal cord injury, and the outcome are altered pharmacokinetics. We hypothesize that spinal cord injury affects drug pharmacokinetics, and they can potentially influence clinical outcomes. If our hypothesis is true, then the implication is to optimize drug dosing strategies in spinal cord injury and enhance healthcare outcomes. To summarize, there are 3 ongoing projects, or 2 if the first 2 ones came up to one large one. It is supposed to be planned to be submitted on June 2024, while the third one is planned to be submitted on November 2024. I would like to conclude my presentation with a quote of Isaac Asimov: "The saddest aspect of life right now is that science gathers knowledge faster than society gathers wisdom." And this is our aim here at CTM, to bring wisdom to society. Thank you very much for your attention.
Thank you. It was a very great topic, the first one especially. All science fiction fans here were listening very closely, I think, for the first one. And I have 2 questions regarding that. The first one is, are there any incidents known that happened because drug overdose in space, or any adverse effects that happened in space because of being there? The second one is, out of curiosity, that are there any drugs that especially were researched and prepared for space use? Because you were talking about drugs like drugs used on Earth that are being used also in space. Are there any drugs that are especially used and developed for space use?
Thank you very much for your questions. Well, for the first one, As far as I know, there's no reported incidents or any case study with this because this is a pretty new thing that's being explored. And for the second question, I don't know any special drug that is used for space. It's the same one. The only thing is that we need to explore these pharmacology issues because, as I mentioned, for neurotherapeutic drugs, let's say in the future, if any epileptic patient will go to space, then doctors who dose the drug for them should be very cautious because the anti-epileptics have a very narrow therapeutic range, and then we should be very cautious when we dose it. So that's the aim of the research. But mostly the drugs that have been researched until now is mostly acetaminophen that I already showed, and also some cardiovascular drugs, but there were not enough studies to do special meta on every of them.
Thank you.
Thank you very much.
Thank you for the presentation. I would like to know that in which way can the spine cord injury affect the pharmacokinetic parameters? Is it because the patients are bedridden, or what's the cause?
Well, spinal cord injury impacts the pharmacokinetics in many ways. We can start from the spinal cord injury affects the muscle mass of the patient, and for example, if we administer through intramuscular way, it will affect the absorption of the drug. Also, because of the bedridden patients, they have problems with gastric emptying, and also the excretion takes more time on these spinal cord injury patients. So. Also, because of gastric emptying, spinal cord injury patients take a lot of laxatives, and laxatives can really impact the pharmacokinetics of the drugs. So there are many points where spinal cord injury can influence, and we plan to explore further on them.
So it can be true for all, for example, ICU patients, not just the spinal cord injury patients, but everybody who is bedridden?
Well, yes, because bedridden patients really impact the pharmacokinetic of drugs, but we decided to focus on spinal cord injury because of we can find, let's say, more comparable articles on that field, because if we say only bed rest, that would be higher heterogeneity of people who are bedridden, and every case could impact the pharmacokinetics in a different way.
Thank you.
Thanks a lot.
I have one question regarding your first project, the research implications. You said that there is a need to research more on the effect of space on the other medication. Is there already a special interest or necessity to study a special class of drugs? Or maybe are there any suitable drugs that will be studied in the future?
Well, there is no, let's say, very special class that we need to focus on, but I would say that researchers need to focus on drugs that have narrow therapeutic window, because that's where the change could be risky for the patients. But as my next colleague in the next presentation will present, the space flight is really an actual thing nowadays, and thousands of people are planned to space travel in the following years. So researching in this way and for these drugs, any classes would be beneficial.